Head and neck. Bones of head and neck. Median nerve passes through pterygoid canal. Vertebral artery passes through foramen magnum. Dorello's canal transmits abducent nerve. Scalp and face. Skin around angle of mandible is supplied by great auricular nerve. Tip of nose is supplied by extensor nasal branch of ophthalmic nerve. Lymphatic drainage of central part of lip is submental nodes. Triangles of neck. Carotid sheath encloses common carotid artery, internal carotid artery, vagus, internal jugular vein. Oral diaphragm is formed by mylohyoid. Lateral pterygoid is depressor of mandible. Temporomandibular joint. In temporomandibular joint, least vascular part of articular disc is central part. Mental foramen is located near first premolar of mandible. Important blood vessels of head and neck. Common carotid artery divides at superior border of thyroid cartilage. Chasagnac tubercle is carotid tubercle at C6 vertebra. Central artery of retina is a branch of ophthalmic artery. Thyrocervical trunk is a branch of first part of subclavian artery. Cavernous sinus. Draining channels of cavernous sinus are superior petrosal sinus, inferior petrosal sinus, superior ophthalmic vein. Abducent nerve and internal carotid artery are direct contents of cavernous sinus. Structures related to lateral wall of cavernous sinus are oculomotor nerve, trochlear nerve, ophthalmic nerve and maxillary nerve. Lymphatics. Submental lymph nodes drain tip of tongue, central part of lower lip, adjoining gums, anterior part of floor of mouth, superficial tissues below chin. Tonsils drained by jugulodigastric lymph nodes. Lymph nodes of trunk is jugulo-omohyoid lymph nodes. Glands of head and neck. Inferior thyroid vein drains into brachiocephalic vein. Isthmus of thyroid gland lies across second to fourth tracheal ring. Parathyroid glands are supplied by inferior thyroid artery. Herring bodies are seen in neurohypophysis. Corpora arenacea is seen in pineal gland. Parotid duct opens opposite to upper second molar. Otic ganglion supplies parotid gland. Pharynx. Fossa of Rosenmuller corresponds to internal carotid artery. Killian dehiscence is an inferior constrictor. Passavant tonsil is tubal tonsil. Rovier's nodes are situated in retropharynx. Tonsils. Palatine tonsil or facial tonsil. Plica triangularis is present in antero-inferior part of tonsil. Bed of tonsil is formed by superior constrictor. Tonsil is mainly supplied by tonsillar branch of facial artery. Larynx. Larynx extends from C3 to C6. Cricoid cartilage lies at C6 level. Abductor of vocal cord, posterior cricoarytenoid. Safety muscle of larynx is posterior cricoarytenoid. Tensor of vocal cord is cricothyroid. Cricothyroid is supplied by external laryngeal nerve. Sensory supply of larynx below vocal cord is recurrent laryngeal nerve. Tongue. Palsy of right genioglossus causes deviation of tongue to right. Safety muscle of tongue is genioglossus. Taste sensations from anterior two-thirds of tongue is carried by chordae tympani. Tip of trunk drains into submental lymph nodes. Posterior one-third of tongue develops from hypobrachial eminence. Tongue muscles are derived from occipital somites. Palate. Sensory fibers from taste buds in hard and soft palate travel along facial nerve. Soft palate is supplied by cranial accessory nerve. All muscles of soft palate are supplied by vagoaccessory complex except tensor villi palatini. Cranial nerves. Smallest cranial nerve is trochlear nerve. Cranial nerve with longest intracranial course is trochlear. Middle superior valvular nerve is branch of maxillary nerve. Nucleus of mesenteric reflex is mesencephalic nucleus of trigeminal nerve. First branch of facial nerve is greater petrosal nerve. Stapedius is supplied by seventh nerve. Alderman's nerve is auricular branch of vagus nerve. Jacobson's nerve is tympanic branch of glossopharyngeal nerve. Vidian nerve is nerve to pterygoid canal. Galen's anastomosis is between recurrent laryngeal nerve and internal laryngeal nerve. Parasympathetic ganglia of head and neck. Otic ganglion is anatomically related to mandibular nerve. Lesser petrosal nerve derives preganglionic fibers from tympanic nerve. Pterygopalatine ganglion supplies lacrimal gland. Deep petrosal nerve is formed from sympathetic plexus around carotid. Parasympathetic secretomotor nerve supply to nose is via Vidian nerve. Largest ganglion in neck is superior cervical ganglion. Ear, nose, eye. Cartilaginous part of external auditory canal is lateral 1/3. Lateral surface of pinna is supplied by great auricular nerve, facial nerve, auriculotemporal nerve. Middle ear, tympanic cavity. Narrowest part of middle ear is mesotympanum. Middle ear is separated from cerebrum by tegmen. Eustachian tube opens in anterior wall of middle ear. Sensory nerve supply of middle ear cavity is glossopharyngeal nerve. Eustachian tube. Length of Eustachian tube is 36 mm. Tensor villi palatini causes opening of Eustachian tube. Inner ear. Cochlear aqueduct connects internal ear with subarachnoid space. In carcinoma base of tongue, pain is referred to ear through glossopharyngeal nerve. Tympanic membrane is derived from all three germ layers. Nose. Uncinate process arises from middle meatus. Largest turbinate is inferior. Inferior turbinate is separate bone. Woodruff's plexus is seen at posterior part of inferior turbinate. Eyeball and related structures. Lamina papyracea separates nose from orbit. Primary action of superior oblique is intorsion. Muller's muscle is found in eyelid. Eyeball. Cornea is supplied by nasociliary bands of ophthalmic. Sclera is thinnest posterior to attachment of superior rectus. Pigmented layer of retina is continuation of inner layer of choroid. High yield updated head and neck bullet points. Frontal suture may persist at metapoic suture. Inion is external occipital protrusion. Lambda is the point on the calvaria at junction of sagittal and lambdoid suture. Vertex is superior point of neurocranium in midline. Foramen magnum is the posterior cranial fossa, while foramen caecum is located in anterior cranial fossa. Anterior and posterior ethmoidal foramina transmits anterior and posterior ethmoidal arteries and nerves, not emissary veins. Foramen ovale transmits the accessory meningeal artery, while foramen spinosum transmits the middle meningeal artery. The groove of greater petrosal now transmits the petrosal branch of middle meningeal artery. Jugular foramen transmits the meningeal branches of ascending pharyngeal and occipital artery. Mastoid foramen transmits the meningeal branch of occipital artery. Foramina in the cribriform plate transmits axon of olfactory cells in olfactory epithelium. Optic canal transmits the optic nerves and ophthalmic arteries. Foramen rotundum transmit the maxillary divisions of trigeminal nerve. Foramen spinosum transmit meningeal branch of mandibular divisions of trigeminal nerve. Muscles of facial expression develops from second pharyngeal arch. Depressor septa inserts into part of nasal septum and widens the alar part of nasal muscle during deep inspiration. Orbicularis oculi is innervated by zygomatic branch of facial nerve. External nasal nerve is cutaneous nerve derived from ophthalmic nerve. External nasal nerve is distributed to skin and dorsum of nose, including tip of nose. Auriculotemporal nerve arises by two roots that surround the middle meningeal artery. Lacrimal nerve passes through palpebral fascia of upper eyelid near lateral canthus of eye. Lacrimal nerve innervates the lacrimal gland via fibers borrowed via communicating branch from maxillary nerve. Mental nerve is a branch of trigeminal nerve. Zygomatic branch of cranial nerve 7 innervates the inferior part of orbicularis oculi. Stylomastoid foramen is located between styloid and mastoid process of temporal bone with cranial nerve 7 and stylomastoid branch of posterior auricular artery traveling through it. Facial nerve and its branches, retromandibular vein, external carotid artery and parotid lymph nodes are found within parotid gland. Parasympathetic fibers from cranial nerve 9 synapse in the otic ganglion before traveling to the parotid gland. Scalp is composed of skin, connective tissue, aponeurosis, loose connective tissue and pericranium. Cavernous sinus laterally to sella turcica and extends on each side from superior orbital fissure to petrous part of temporal bone. Dura mater is innervated by all three divisions of trigeminal nerve, C1 to C3, possibly vagus nerve. The cavity of medulla oblongata forms the inferior part of fourth ventricle. CSF flows from each lateral ventricle through an interventricular foramen into third ventricle and then through cerebral aqueduct into fourth ventricle and finally through median and lateral apertures into subarachnoid space. Carotid canal is located in inferior surface of petrostemporal bone in middle cranial fossa. Carotid canal contains the internal carotid artery, sympathetic plexus and internal carotid venous plexus. Oculomotor nerve emerges between superior cerebellar artery and posterior cerebral artery. Abducent nerve emerges between labyrinthine artery and anterior-inferior cerebellar artery. Middle meningeal artery supplies more blood to calvaria than to dura, which is preferentially supplied by vertebral artery. Superior oblique takes its origin from body of sphenoid bone, while all four recti muscles takes origin from common tendinous ring. Superior oblique abducts, depresses and rotates the eyeball medially. Long ciliary nerves conveys postsynaptic sympathetic fibers to dilator papillae and afferent fibers from iris and cornea. The descending palatine artery is a branch of third part of maxillary artery. Labyrinthine artery is a branch of basilar artery, which is a part of vertebral artery system. The temporomandibular joint is a modified hinge type of synovial joint. Hard palate is composed of palatine process of maxillary bone and horizontal plates of palatine bone. The tensor veli palatini is innervated by medial pterygoid nerve, a branch of mandibular division of trigeminal nerve. Tensor veli palatini tenses the soft palate and opens the mouth of auditory tube during swallowing and yawning. Arytenoid and cricoid cartilages and laryngeal connective tissues are formed by lateral plate mesoderm. Lower lip is formed from mandibular prominence. Genioglossus depresses the tongue and assists in protrusion. Hyoglossus depresses and retracts the tongue. Styloglossus retracts the tongue and draws it up for swallowing. Peltoglossus elevates the posterior part of tongue. Sweetness is detected on the apex or tip of the tongue. Saltiness is on the lateral margin and soreness and bitterness on posterior part. Dorsal lingual arteries supply the posterior tongue and palatine tonsil, while deep lingual artery supplies anterior tongue. Greater petrosal nerve, parasympathetic fibers of facial nerve, joins the deep petrosal nerve, sympathetic nerves from internal carotid plexus to form nerve of pterygoid canal. Superior meatus is a narrow passage inferior to superior nasal concha in which posterior ethmoidal sinuses open. Nasolacrimal duct drain into inferior meatus. Inferior nasal concha is a separate bone, whereas superior and middle nasal concha are extensions of ethmoid bone. External surface of tympanic membrane is innervated by auriculotemporal nerve and small branch of vagus, while internal surface is innervated by glossopharyngeal nerve. The medial labyrinthine wall separates the tympanic cavity from internal ear. Anterior carotid wall separates the tympanic cavity from carotid canal. Pharyngotympanic tube, also known as Eustachian tube, opens posterior to inferior meatus of nasal cavity. Tensor veli palatini, levator veli palatini work together to open Eustachian tube, which is supplied by ascending pharyngeal artery, middle meningeal artery, and artery of pterygoid canal. Saccule is continuous with cochlear duct through ductus reunions. Typical cervical vertebra have transverse processes with foramen transverse area, which transmits both vertebral vein and artery, while in C7 it transmits only vertebral vein. Floor of posterior triangle of neck is formed by muscles covered by prevertebral layer of deep cervical fascia. Anterior triangle contains submandibular, submental, carotid, muscular triangles, while posterior triangle contains occipital, supraclavicular triangles. The only lateral vertebral muscle that is innervated by dorsal rami is splenius capitis. Arytenoid, corniculate, cuneiform cartilages are paired, whereas thyroid, cricoid, epiglottis are single. All intrinsic laryngeal muscles are innervated by recurrent laryngeal nerve except cricothyroid, which is innervated by external laryngeal nerve. Internal laryngeal nerve is sensory nerve of larynx. Superior laryngeal artery and vein. Internal laryngeal nerve passes through the gap between middle and inferior constrictors. Inferior laryngeal artery, recurrent laryngeal nerve pass through gap inferior to the inferior constrictor muscle. The mastoid processes are absent at birth, hence the facial nerves are close to the surface when they emerge from stylomastoid foramen and are easily injured during delivery. Inferior alveolar nerve blockade is done at mandibular foramen. Epidural hematoma consists of blood from middle meningeal artery. Ptosis is caused by lesion to oculomotor nerve which innervates the levator palpebrae superioris. Interruption of cervical sympathetic trunk results in Horner syndrome. Pupillary constriction, ptosis, anhidrosis of face and neck. Lesion to hypoglossal nerve due to neck laceration or basal skull fracture, protruded tongue deviating to the affected side and altered articulation. Cribriform plate fractures causes olfactory tract lesion, anosmia or CSF rhinorrhea. Vagal nerve lesion due to sagging of soft palate, deviation of uvula to normal side, hoarseness. Neck laceration due to tension of spinal root of accessory nerve causes paralysis of sternocleidomastoid and superior fibers of trapezius, thus dropping of shoulder. The posterior belly of digastric and stylohyoid muscles are innervated by facial nerve, whereas anterior belly of digastric and mylohyoid muscles are innervated by trigeminal nerve. The geniohyoid and thyrohyoid muscles are innervated by C1 through hypoglossal nerve. Trachea begins at the inferior border of cricoid cartilage and ends by bifurcating into primary bronchi at level of sternal angle. Isthmus of thyroid overlie the second to fourth tracheal ring. Parathyroid glands are two superior, two inferior small endocrine glands. Superficial branches of cervical plexus include great auricular, transverse cervical, supraclavicular, lesser occipital nerves. Deep branches of cervical plexus consist of ansa cervicalis, which supplies infrahyoid strap muscles, and phrenic nerve, which runs on scalenus anterior, enters thorax to supply the diaphragm. Common carotid artery arises from brachiocephalic trunk on right and from aortic arch on left. Carotid sinus lies at origin of internal carotid artery and functions as pressoreceptor or baroreceptor. Infraorbital fossa contains muscles of mastication, mandibular nerve and its branches, maxillary artery and its branches. Muscles of mastication are innervated by mandibular branch of trigeminal nerve. Lateral pterygoid opens the jaw and other muscles close the jaw. Mandible is protruded by lateral and medial pterygoid muscle and retracted by temporalis and masseter muscles. Optic nerve mediates the affected limb of pupillary light reflex, whereas parasympathetic fibers in oculomotor nerve mediate the efferent limb. Ophthalmic nerve mediates afferent limb of corneal blink reflex by nasociliary branch, while facial nerve mediates efferent limb. Maxillary nerve mediates the afferent limb of sneeze reflex and vagus nerve mediates efferent limb. Mandibular nerve mediates the afferent and efferent limbs of jaw jerk reflex. Superior sagittal sinus lies in midline along the convex border of falx cerebri between cerebral hemispheres. Inferior sagittal sinus lies free edge of falx cerebri and is joined by great cerebral vein of Galen to form straight sinus. It's all a bit clumsy. Head and neck is such a difficult topic, no one can explain properly. We have to by heart some points and we have to understand some points and we have to mix the two strategies and we should go on.